everyone, this is Dr. Saroj Siddharthi from the platform of UKMLA with DSS. So let's just continue our counseling sessions, and the topic that we are going to discuss today is discharge counseling. Okay, so there are like 3 to 4 different cases in which you would have to counsel a patient when they would be getting discharged. Okay, and the pattern is pretty much same. It's pretty much similar to what we have discussed in the lifestyle modification and in the previous counseling sessions as well. But just I'll just share a example with you very briefly, that there is a patient, 13-year-old girl, who was admitted with generalized tonic-clonic seizures, and now she is ready to be discharged, and she's been prescribed with sodium valproate. Okay, she is now ready for a discharge for home. Please talk to the mom and address her concerns. Okay, so uh, it would be very clearly mentioned that okay, the patient is getting discharged. Okay, now there is a confusion. You need to assess that okay, if along with the discharge, if there is something else that may be expected of you. Like for example, in the previous case that we did, that was the lifestyle modification case. In this case also, the patient was getting discharged home. Okay, but along with the discharge aspect, you had to counsel the patient about the lifestyle changes as well. So it became a lifestyle modification counseling station rather than becoming a typically discharge counseling station. Okay, but in this case, the patient is just being discharged. Okay, and she's just here with some concerns. Okay, the concerns can be anything. Okay, so now, since you know that this is a counseling session, and you will either have to do the discharge counseling or lifestyle counseling. Okay, you just ask about that. Okay, thank you so much for coming, Miss Victoria. I can see from my notes that you are here with some concerns regarding your daughter Anna Smith, who is about to be discharged. May I know what you want to know? Okay, and then that concern would be that, doctor, yeah, I want to know that how can I prevent the seizure that she had, and what do I need to do whenever she experiences another episode of seizures. Okay, so that is what her concern is. Okay, and now what I want to share in this particular thing is that it's not always that you would have to explore the concern further. Okay, there wouldn't be always a case that you would always find a follow-up question. Like for example, in this case, you're not going to ask that okay, any particular reason why you want to know how to prevent and what to do an attack. Of course, like it's pretty much straightforward. It's pretty clear that she cares about her child, and that's why she wants to ask about the prevention and what to do in an attack. Okay, so do not just ask and do not force yourself to explore the concern furthermore, that why do you want to know about it, just like the way you have been doing it in other sessions as well. Okay, so be flexible on this. All right, and then you gotta say that okay, can you please tell me more about your condition, about your daughter's condition? Do you have any idea about what epilepsy is? What are the causes? And you want to know about prevention, but do you have any idea what may be the possible preventive strategies, or what you need to do whenever you get an attack? And the idea about the condition, and what have the doctors told to you about the condition so far. Okay, so you just assess the knowledge like you do in box number 1. Okay, and then you try to do the data gathering, and you're gonna be like that, okay, will it be okay if I can ask you a couple of more questions so that I can be in a better position to address your concerns. Okay, and then you'll move on to the box number 2, in which you would be doing the essential data gathering. Okay, now let's just go back to those 6 parameters. Okay, that we talked about in the box number 2, in which you explore the situation. Okay, in this particular case, the situation and the symptoms and the disease was basically seizures. Okay, seizures was an incident that happened. Okay, so in the first part, you got to do something called the BDA, the incident history, that we talked about in the previous lecture as well. That, can you please tell me what happened before she was, having the seizures? What was she doing before she developed the seizure, how did it happen, when did it happen, okay. And then you talk about during the seizures, that since how long did the seizure continue, what was she doing during the seizures, was she moving just part of her body or was she moving her entire body, did she lose her consciousness during the seizure, did she roll her eyes upward, or did she bite her tongue during the seizures, did she lose control over her bowels, and did she ended up peeing or pooping in the pants during the seizures. By any chance, did she have any frothing from the mouth? Okay, so all the during part. Okay, and then after the seizure, when it stopped, was she conscious? Was she in her senses? Was she feeling dizzy? Was she able to speak something? Was she able to recall what happened with her? Okay, so the typical BDA history or the incident history, in which you try to explore what the episode was. Okay, uh, then you can ask about how is she now, because you have to explore the situation as well, that how is she now, and has she had any more seizures or not. Okay, so that is like the exploring the situation, exploring the symptom. That is the first parameter. Okay, then exploring the risk factors. It is like really really important whenever you are discharging the patient. Okay, so the risk factor is like, you're going to go like that. Okay, what does she do in her free time? Okay, what does she enjoy during her free time? Any hobbies that she have? Why am I asking this question? Because hobbies such as adventure sports like swimming, mountain climbing, horse riding, okay, or maybe some aggressive sports. Okay, all of these things are the risk factors of seizures. Okay, so you got to ask about that. Then how is her sleep? Why? Because sleep deprivation is again another risk factor for a patient developing seizures. Okay. Then how much time does she spend watching TV? And does she like to go to disco, or does she like to go to a bar or something like that? Why? Because flashing lights is another risk factor for seizures. Okay, so you got to ask about the risk factor of the disease. Okay, because since you're discharging the patient home, you would have to counsel about these risk factors to the patient. Okay, so that is why this particular aspect becomes really really important. Okay, then you're going to talk about the complications. Okay, that and you have already asked about some of them, but you may just ask about, did she develop any numbness or any weakness or any cough because you're thinking about aspiration. Okay, why? Because you may have to counsel about the possible complications, like for example, you may have to talk about the risk of developing aspiration, the risk of developing focal neurological deficits because of seizures. Okay, so you may have to talk about all of these things. So these questions also become really, really important. Then the psychosocial aspect, as I mentioned, it's always important in the counseling stations. Um, Really important to check whether or not she attends school. Why? Because you would have to ask the mother to inform the school and inform the teachers about the fact that she may develop an epileptic episode in the school as well. So just inquire about her psychosocial life. Then who does she live with? Does she have friends and family members available? Because you may have to give the advice of telling this to her mother, that their friend should also know that she has epilepsy, and she can end up getting a seizure when she's with her friends as well. Okay, so take a holistic approach. Okay, and make sure that you are covering the psychosocial aspect and adequate things of the psychosocial aspect. It's not just how your life is going, and what do you do for a living, and do you drive or not. Psychosocial aspect can be anything. Okay, like for a child, the psychosocial aspect is completely different. For a person middle aged, the psychosocial aspect is different, and for elderlies, the psychosocial aspect is completely different. Okay, the typical question that we ask about that, what do you do for a living, do you drive, how are things at home, this type of question is typically for someone in the age bracket of 16 to 65. Okay, but for a child, the psychosocial aspect would be, does the child attend the school, how are they performing academically, who do they live with, how are the conditions at home, do they have friends, of course they would have family because they're just a kid, but do they have friends available or not. And then similarly, if you're dealing with an elderly, the psychosocial aspect would be different. Okay, um, you would be asking about that, who does she live with, who do they live with, do they have family members for their support, are they able to perform their task independently, are they able to get involved in daily activities of their life. That is what the psychosocial aspect for the elderlies are. Okay, so make sure that you are asking about the relevant psychosocial aspect and the relevant questions that are there for the psychosocial aspect. Okay, all right, yeah. So that is very simple, the box number one and the box number two. Okay, then you can do the meftosa. And since this is an epileptic the patient getting discharged, you may want to do the neurological examination just to make sure that the patient is completely all right. Okay, then box number three is just simple explanation, that okay, epilepsy is a condition that is characterized by abnormal activity in the brain leading to abnormal jerky movements. Okay, and then there is no more further explanation that you may want to give. Okay, it's just addressing the concern, and it's completely up to you. The concern that I've been addressing in box number four, you can address that in box number three as well. Okay, it wouldn't make a very significant difference. It is just for your understanding. Okay, so I've mentioned in box number four. Okay, uh, her main concern was that what if she develops another attack, and how do I prevent it from happening. Okay, so you just talk about what are the things that can be done, and then you try to explain what the recovery position is whenever somebody is developing a seizure, or whenever somebody is having an epileptic attack. Talk about the recovery position, how to make sure that you put the patient in the recovery position. Then ask them to give them the advices to stay with them, monitor them, and see if they're breathing or not, see if they're conscious or not, and then make sure that you seek medical help, and you immediately call the ambulance and get to the A&E. Okay, so this is what addressing the concern would be. Okay, so this is just an example because this was the particular concern in this case, but in the discharge case it can be anything, the concern can be literally anything. Okay, and you may be getting an idea that in some of the cases the discharge and the lifestyle modification counseling may just overlap a bit. Okay, you just need to see that on what aspect you need to focus. Okay, both of the cases would present to you in a very similar way, but in a few cases you would have to focus more on the lifestyle advices rather than actually the advices about the prevention of the disease itself. Okay, so it's very similar but not same. Okay, there's a very fine line between the discharge counseling and the lifestyle modification counseling. Okay, then these advices, like the discharge advices, this is the most important thing. Why? Because the medication have already been explained to them. Okay, they've already written that she have been prescribed with sodium valproate, and the meds has already been explained to the mom. That means that you don't need to get into the detail, into the mechanism of action of sodium valproate, and how they should be taking it, and whether or not they should be taking it with water, or before meal or after meal. All of those details have already been explained to them. Your main focus in discharge counseling is basically advice based. Okay, what kind of advice are you able to make, and what kind of advice are you able to give to the patient who is getting discharged. Okay, like for example, this is something which can be prevented. Okay, so you need to give those advices on the basis of the data that you have gathered over here. Okay, like some of the activities should be limited for safety, like high risk activities. If she enjoys cycling, she should wear a helmet and wear protective gear. Why? Because if during the surgery she develops a epileptic episode, then she may develop some injury if she end up falling down. Okay, then you need to give advices about how she showers, because showers are much more safer than the bath, because if she's in a bathtub, and then if she develops an epileptic attack and if she loses her consciousness, there is a very strong chance that she may end up drowning. So try to give these advices that prefer shower over taking a bath in the bathtub. Okay. Then general advice is that should avoid locking the bathroom. Okay. So if she develops any attack, somebody can just enter inside and just try to save her. Okay. Then you give advices about flashing lights and the risk factor that we talked about, that does she go to a bar, does she like to go to discos. Okay. So make sure that all of these advices and all of the data that you've gathered, you're using it in your advices and you're using it in your management. Okay. Then advices about cooking. It can be risky because if she develops a epileptic attack while cooking, she can just end up falling on the hot stove and can harm herself. Okay. So you may realize that all of these things, okay, like these are not the medical management. Okay. And this is what the beauty of counseling session is. You need to be able to give holistic advices. Okay. And your advices should involve the patient directly. Okay. Your data should be such that you are able to gather enough information and use that to give relevant advices. Okay. Not all of the advices would be relevant in all of these cases. Okay. Somebody may be not not into the habit of cycling, or somebody may not have the hobby of going to cycling. Okay. So that particular advice will not be relevant in that particular patient. Okay. So what I'm trying to teach you over here is that try to use the relevant data, try to use the relevant information and give those advices. And you can see that there is nothing medical about it. There is no medical knowledge, there is no clinical knowledge that you are applying over here. It's just the way that you are able to use the situation. It's just the way how well you are able to talk about the prevention. Okay. And this is what counseling is all about. Okay. They're not expecting you to know what the medical management of seizures is in this case. They're expecting you to know that how well you are able to talk to the patient who has had seizure, how well you are able to give them preventive advices, how well you are able to make sure that you counsel them about the do's and don'ts before getting discharged. Okay. So it's a very comprehensive thing, and it will only you will be only able to master it if you are able to do two things. Number one, if you are very well aware of the content, if you have read all of these things. Okay. If you know this particular content, if you know that these are the possible advices that I need to give to a seizure patient, and then only if in the exam somebody comes up to you with epilepsy and getting discharged, you will be able to counsel because you will be very confident on your knowledge. You would be very confident on the things that you have read. Okay. So make sure that you have read each and every counseling session, and you have at least read it once, so that you have the basic idea. Because you have to speak for like 4 continuous minutes. Okay. You need to give them advices in a very convincing tone, in a very nice and a very you know reassuring tone, and you will be only able to do so if you have the content in your mind. Okay. So do not ignore the notes, do not ignore reading stuff. Okay. Because a lot of people just end up practicing so much, and they don't read enough. Okay. And that is the problem. If you don't read enough, you would not be able to hardwire your brain into speaking these things or saying these things. Okay. That are important, and should be said. Okay. And once you've read the notes, once you know all of these things, once you have the content in your mind, then make sure that you've practiced it a lot. Okay. Because this is something that you cannot excel until unless you have practiced it enough. Okay. Counseling is an art, and it can be only practiced, it can only mastered when you have practiced it enough. Okay. So yeah, then the referral and admission part, because that wouldn't be very necessary because you're already discharging the patient home. Okay. So you can just talk about regular follow-ups with the GP, and then you can talk about the medical management, like routine EEG, the sodium valproate that is prescribed. Okay. You can talk about it very briefly, that you need to take it for a long term and you need to be compliant to it. Okay. Yeah, the ensuring the compliance. just a couple of those advices. Okay, just be very advice oriented in cases like this, unless you have been asked to explain the medication. Okay, but in the cases that we have discussed, they did not ask you to explain the medication. And then safety netting about the same disease and the symptoms that the patient may present in that particular disease. Okay, so yeah, that is what the structure, and that is how you need to go about it. And couple of things that I would like to share before I enter this discharge scenario and discharge cases. There are two services that I want to talk about. Number one, the SALT team, the speech and language therapy team. Okay, so in the NHS, the individuals who have had speech problems. Okay, and who are those patients? The patients who have had stroke, neurological disorders, learning disability, autism, or head and neck cancer. Okay, oral cancers, who are not able to speak properly. They are basically provided assistance by the SALT team. Okay, that is the speech and the language therapy team. Okay, they often provided in the hospital. Okay, but they also have some clinics as well. So whenever you're discharging someone with any condition like this, like stroke, neurological disorder, and this is epilepsy, this patient did not have any speech disturbances. But if the patient has had any speech disturbances, then you may want to refer the patient to the SALT team. Okay, and in most of the cases, before discharging the patient like these, the SALT team do visit the patient once, and then they do assess the patient for ensuring that the speech and language is intact, and then only they give you the clearance to discharge such a patient. Okay, so you can just mention about the SALT team whenever you're dealing with patients of stroke, neurological disorders, learning disability, autism, or someone with an oral cancer. Okay, so just keep that in mind. Not just for the discharge counseling part. Okay, this is not just a discharge specific thing, but this is a general NHS service that you can use in all stroke cases or neurological disorders. Okay, you can talk about the SALT team if you feel that the speech of the patient may be disturbed. Okay, then the home discharge team is basically consists of a couple of members of the multidisciplinary team who basically come and assess and ensure that the patient is safe for the discharge. Okay, a lot of patient may need some ongoing care and ongoing support after being discharged. Okay, like for example, elderly patient. Okay, who are unable to walk, was had a recent total knee replacement or a total hip replacement, they may need physiotherapist as well. If their home is not very much friendly for a person who has mobility issues, okay, then they may want to involve the occupational therapist as well. Then I talked about the elderly groups who are maybe unattended, who do not have enough support, who do not have enough friends and family members available. So there are social workers as well in the home discharge team. Okay, and a lot of people may need home care and medication management, reminders for medication. They may be alone at the home. Okay, so they may want someone to visit them and help them move as well. Okay, so like all of those things, like after you're going home from the hospital, and if you need any kind of assistance after your discharge, the home discharge team is going to be there at your service. Okay, so it consists of multiple multi disciplinary team and multiple disciplines that all together work together to provide a very supportive environment for the patient who is getting discharged. Okay, so you should be aware of the home discharge team, particularly when you're discharging elderly patient. For the young patient like these, the home discharge team will not be that relevant. Okay, but let's suppose that if a young patient comes to you with a fracture, and he or she may have had a open reduction in internal fixation, and the fracture got repaired, and now if they're getting discharged, then you may want to just involve the home discharge team, so that the physiotherapist and the occupational therapist can just see and make sure that everything is all right with them while they're getting discharged. Okay, so yeah, that is pretty much it from the discharge part. You should be aware of these two things, and you should be aware of how to use this data and to make sure that you're giving the right advices. All right. Now, let's just move to the next section, that is the explanation counseling. Okay, so you will encounter a few cases in which you would have to explain about a particular condition and about a particular procedure or a particular facility or a particular investigation. Okay, and I call it as the explanation counseling. Okay, there are a few stations that are there in which you have to explain a particular procedure. Okay, or they may just come to you with a concern about a particular service that is being offered. Like for example, they may be just concerned about the flu vaccine, they may be concerned about the 8-week vaccination. Okay, so you would have to explain what the 8-week vaccination is, you would have to explain what the flu vaccine is. Then somebody may just want to ask about a procedure, like for example vasectomy, so you would have to explain what a vasectomy is. Somebody may want to just ask about colonoscopy. Okay, like for example, in this case, there is a patient who uh, was basically came to the doctor, and they did a sigmoidoscopy done, and that showed some polyps. And now, in order to further investigate, uh, the doctors have advised the patient to get a colonoscopy done. And now the patient is here, that like what is a colonoscopy, why do I have to get a colonoscopy done, and if you had to do a colonoscopy, then why did you get a sigmoidoscopy done in the first place. Okay, so all of these medical procedures you would have to explain that okay, some of the procedures are less invasive, some are more invasive, what does sigmoidoscopy show, what colonoscopy would show, why colonoscopy is important. Okay, so you would have to basically explain the things. Okay, and that is why I call it as the uh, explanation counseling. Okay, so the pattern is pretty much similar. You would just go about it that okay, what is your main concern as of today, and they're going to say that doctor, why did you get the sigmoidoscopy done if you had to do a colonoscopy, and I want to know what a colonoscopy is, and why do I need to get it again done again. And then you're going to assess the idea that okay, do you have any idea about what colonoscopy is, do you have any idea what are the indications, do you have any idea why do we offer it, have anyone talk to you about it, did the medical team or any doctor explain anything about any of the procedures to you. Okay, just to assess the knowledge and just to get the idea. And then you're going to move on to the data gathering. Okay, so amongst the 6 parameters of box number 2, the first parameter was exploring the symptoms and exploring the situation. Okay, so ask about it, why did you get the sigmoidoscopy done in the very first place. Okay, why did you even get a sigmoidoscopy done? And they're going to say that doctor, yeah, I was having some bleeding from my back passage. Okay, so just explore very briefly. Okay, do not need to go into a lot of detail, just very briefly explore the you know uh, parental bleeding. Okay, can you please tell me how it happened, when it happened, since how long have you been having it. Okay, then you may want to just ask about a couple of more questions like flaws and change in bowel habits to rule out colorectal carcinoma. Okay, and the complications of parental bleeding, like for example anemia, somebody is bleeding, so you may just want to ask about shortness of breath, palpitations and dizziness. Okay, so you're not trying to diagnose something over here, but you need to be red flag oriented, and this is what you need to do in the entire plateau exam. Okay, you must have seen that we have been focusing on very heavily on the red flags, and we've been very heavily focusing on the complications and the things that can be fatal and the things that can be dangerous. Okay, so do explore the PR bead in uh, along the lines of colorectal carcinoma. Okay, and then always think about the complication that and the symptoms that may occur because of certain complications of the PR bead, like for example anemia. Okay, so shortness of breath, palpitations and dizziness. Okay, then you ask about the risk factor of what, colorectal carcinoma, because this is what you are thinking. Okay, in the polyp you are thinking about dysplastic changes. Okay, so dysplastic changes means that your thinking about colorectal carcinoma. So just ask about the risk factors like diet, smoking, family history. Okay, all of these things, is something that you should touch, that something you should ask, but it is not the most important thing. What the most important thing is basically the complication that occurred. Okay, this patient would be, kind of furious. This patient would be not a typical angry patient, but they would be kind of annoyed that, doctor, why did you get the flexible sigmoidoscopy done if you had to do a colonoscopy again? Okay, so along with the explanation and along with the concerns, okay, the patient would also be a bit annoyed as well. So, in the complication aspect, you have to explore the complication of this particular procedure that happened before. Okay, like for example, you had a sigmoidoscopy 2 weeks ago. Has anyone discussed the results with you? They were like, no. How was your experience during the procedure? Okay, try to understand why this patient is annoyed, why this patient is not very happy about it. Okay, then did you have any pain or any bleeding afterwards? Okay, these are these are the complications of the flexible sigmoidoscopy that was done in the patient 2 weeks ago. Okay, were there any difficulties during the procedure? Okay, how was the experience? Okay, and this patient is going to say that, doctor, it was an uncomfortable experience. Nobody likes to go through process like this, in which a flexible scope is entered into the back passage, and it's kind of embarrassing and it's kind of uncomfortable. Okay, so you have to explore this, and this is what the main part of this particular station is. Okay, so it's completely up to you. If you can think about it as a complication of the sigmoidoscopy, okay, then you can ask it in box number 2. But if you want to think about it as further exploring the concern, okay, then you can ask it here in the box number 1 as well. Okay, so this is the flexibility that you have. Okay, so very important bunch of questions, very important set of questions. Okay, then the psychosocial aspect, that who is at home and occupation, and in the meftosa, you would want to ask about the risk factors like blood thinners or comorbidities that may lead to PR bleed and may lead to cancers. And in the examination, just offer GP and DRE. Okay, DRE may be relevant in colorectal carcinoma if if the patient is having PR bleed and you are thinking about hemorrhoids or anything, any pathologies related to the anal canal, then you may want to just do a DR. Okay, so this is what the data gathering in this would be. Now, since this is an explanation counseling, okay, try to understand this thing. It's a very important model that I'm teaching you right now. Since this is an explanation counseling, okay, the explanation part, the box number 3 would be very heavy, and it would be full of explanations. Okay, lot of information you need to deliver, and this is just one example of colonoscopy. You would have to do it for every case. Somebody asking for laparoscopic cholecystectomy, somebody inquiring about vasectomy, somebody inquiring about the 8-week vaccination. Okay, so the box number 3 would be the main thing that you would be covering. Okay, so you gotta explain the situation that, okay, you have been invited for colonoscopy because some polyps were found and removed during your sigmoidoscopy. So explain the test result. Okay, explain the results of the sigmoidoscopy, and then tell that what does this polyp means. That the presence of polyp means that there may be something serious like a cancer that may be going on inside. So polyp is a thing that we cannot just ignore. We cannot just let it be there. Okay, right now these polyps were found to be benign, which means that they were not cancerous, but the possibility of the cancer cannot be excluded. Okay, and we had to remove the polyp for your safety. But in order to ensure that you are safe, we are further safe, and you do not have anything sinister such like a colorectal cancer, we need to do a colonoscopy then. Are you following me so far? Does it make sense? Do you have any concerns regarding it so far? Okay, Since it's a lot of information, you don't want to just do something called the verbal diarrhea. That means that you have got so much in your brain and then so much in your head and just go out there and just throw it on the face of the patient. Okay, you don't want to do that. Okay, so take some breaks. Do you have any concerns regarding this? Okay, do you have any questions regarding this? Okay, and if the patient doesn't have any questions regarding the polyp or regarding the sigmoidoscopy, then fine, then move on. Okay, but if the patient has any concern, okay, like for example this concern that I've mentioned in box number 4, that okay, fine, you think that okay, there is a colonoscopy need, then why did you do a flexible sigmoidoscopy? Okay, so you would have to address the concern of the patient that okay, we prefer to begin with the least invasive procedure that requires minimal preparation, like the sigmoidoscope. And since we were not really sure, and since the suspicion was not the high that time, we did not want to put you in much more pain, and we did not want to put you into the trouble of getting into much more invasive procedures. Okay, so that is why we chose the minimally invasive procedure like flexible sigmoidoscope. Okay, fine. If they get convinced, and then you say, does that answer your concern? Does that answer your question? Okay, and if yes, then just move on. Okay, so now this is explanation station. Okay, you have to explain and you have to counsel about the colonoscopy. So you would have to um, not very briefly but briefly explain about that particular procedure, that it's a test, and it's a procedure in which basically a camera is inserted along with a scope into your back passage to basically visualize what's going inside your large bowel or your intestines, okay, also known as the colon area. And then a thin flexible tube would be inserted, and a small amount of gas will be introduced to make sure that the area is dilated and the visibility is ensured. So step by step, every procedure, okay, and you would have to read all of this thing and learn all of these things when you're reading the notes. Okay, then a sedative would be given to you to relax, and if any abnormalities or any additional polyps are found, a small tissue may be taken for further testing. Over here, we are talking about biopsy. Okay, why is it important to say? Because you may want to take the consent of the patient for taking a sample and sending it for biopsy. Okay, so what the procedure is, what will we do before the procedure, and then how long would the procedure take? Okay, the procedure is going to take up to 30 to 45 minutes. Okay, and then what are you aiming because of this procedure? Our goal is to make sure that your safety is ensured and we remove any remaining polyp or anything that may be cancerous that can get identified. Okay, and once you have done saying that, once you have explained everything, you gotta take the consent and you gotta take the agreement of the patient, that are you happy to proceed with the procedure? Does it make sense? Does it answer your concern? Now do you understand what a colonoscopy is? Okay, so after that you gotta say, do you have any concern? And then the patient may just drop another concern, that yeah doctor, are polyps cancerous? Okay, then answer them that most of them are not cancerous, most of them are benign, but they do have the potential to convert into something cancerous. So that is why we have to do this procedure to make sure that you are completely fine. Okay, so this was what the explanation part, and this is like a really really important part of your consultation of your management. Okay, be very very accurate and be very very well versed with the explanation part. Okay, then whenever the patient comes to you for any explanation counseling regarding a procedure, or whenever you have to talk about a procedure, then you may want to give us few advices. Okay, some of those advices are the pre-procedure advices and some of them are the post-procedure advices. So I'll just quickly share with you that what are the pre-procedure advices. Okay, number one, talk about NPO, none per oral, that you need to be none per oral at least 6 hours before the surgery. Okay, then explain that before the procedure, a laxative may be given to you for at least 24 hours before the procedure to make sure that your bowels are completely empty. Okay, This will cause diarrhea to clear your bowel content, and it is recommended to stay home during this period. Okay, and make sure that you keep on drinking fluids and all. So this is what the pre-procedure advice is, but this is specifically for colonoscopy. For other procedures, there would be some different devices. Okay, if somebody is on any blood thinner medications, why do we ask about the blood thinners over here and the comorbidities in the box number 2? Because if somebody is hypertensive, somebody having diabetes, or if somebody is on blood thinner medications, you would have to follow the pre-op approach, and you will have to follow the pre-op advices to make sure that the medications get stopped, and make sure that the patient is not on blood thinner medications, to avoid any risk of bleeding and all. Okay, because this is an invasive procedure. Okay, so make sure that you touch upon the aspect of the pre-procedure advices, and go and read the notes for each and every case, to make sure that you are well aware of the pre-procedure advices that you should be giving. Then you gotta give some post procedure advices, that after the procedure, there would be few things that you would have to like take into account. Like for example, you will not be able to eat immediately, but once you are recovered from anesthesia, we'll allow you to eat and drink. Then if the patient is diabetic, you may want to talk about drug doses, that how and when we are going to resume the normal medication of the patient, like the insulin. Okay, then the patient may have some concern that, doctor, when will I be discharged? Okay, uh, so it depends on procedure to procedure. For endoscopy and for daycare procedures like these, we can discharge the patient on the same day. And but if there is a complicated surgeries, like for example laparotomy, or let's say laparoscopic surgery as well, then we may want to just keep you for a couple of days or for a couple of weeks. Okay, so it really depends on procedure to procedure, that what kind of discharge advices you would want to give to this to a particular patient. Okay, uh, then for 24 hours, like whatever procedure the patient is going, they would be under anesthesia. So try to give some advices, that for 24 hours avoid signing important document, or operating with heavy machinery, or working at heights. Why? Because the effect of anesthesia may be there for to 24 hours, and you may not be in your 100% consciousness, and you may not be 100% mentally there. Okay, so try to avoid these things. Do not drive until you can make sure that your reflexes are like 100% there, and make sure that somebody stays with you for 24 to 48 hours, because the effect of anesthesia may just be there, and may just create some problems for you. Okay, so all of these advices, like the pre-procedure and the post-procedure advices, the basic over here is to understand that you need to give these advices. What advices? It would vary from case to case, so make sure that you read the notes. Okay, then there wouldn't be any referral or admission, because the patient is already there at your your facility to get the investigation done or get the procedure done. But you may want to just run some investigations, or you may want to do some medical managements, like for example stopping a drug, or doubling the dose of a drug, or running the patient for cardiac fitness, and making sure that all the baseline investigations are sorted. And then if you're sending the patient home, and if the procedure is scheduled for some other day, then just safely let the patient. But mainly it is going to be explanation oriented and advice oriented. Okay, so all the counseling sessions are going to be advice oriented, but somehow or the other you would be touching on different aspects, like the concerns, medical management, explanation. Okay, so you need to keep this thing in mind, that each and every counseling case is different. Okay, and you may have to follow the similar approach, but not the same approach for all the type of counseling, and that is why I've arranged separate lectures for each and different type of counseling session, and that is why I have shared each and a type of category, one session from one scenario from each type of categories, to make sure that I've given you the holistic approach, and I've showed you that how you can apply the structure, and how it varies from category to category. Okay, so that is pretty much it from my side regarding the explanation and the discharge counseling. If you've got any queries and any questions regarding it, then please drop them down in the comment box, and you can reach out to our social media as well, and I would love to address any query that you have. That's pretty much it from my side. See you in the next lecture.